Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Saturday, October 28th is National Drug Take-Back Day. To help you clean out your cabinets, Dr. Caleb Alexander is here to talk about why the day exists, what medications and equipment might qualify, and how to find a drop-off event near you. If you're listening to this podcast after the 28th, don't worry. There are plenty of opportunities to safely dispose of your unused or expired medications. Let's listen. Caleb Alexander, thank you so much for being back on Public Health on Call. How are you?
I'm fine, and kind of you to have me. Thank you.
Wonderful. So today we are going to talk about National Drug Take-Back Day, which is this Saturday, October 28th. So first of all, tell us, why does this day exist?
Take-back days are one of many means that are used to try to claw back the millions of bottles of prescription drugs that are sitting all over America in people's bathroom cabinets and bedroom nightstands and the like. And so it's an effort that has been conducted successfully in local communities around the country in an effort to try to reduce the amount of unused and unneeded prescription medicines that are just sitting around all of our houses.
And so what kind of drugs are we talking about here?
Well, I think that, a take-back day is fair game to bring any medicine you like, but I think the real concern and the real opportunity is for medicines that are controlled substances or that are otherwise especially dangerous and especially unwise to have sitting around your house. And so given that we continue to see in the United States record morbidity and mortality from opioids, I think that's sort of exhibit A. But there are many other controlled substances, stimulants, benzodiazepines, other controlled substances that are, sitting in homes all across America that are also, I think, fair game. And people should be encouraged, if these are not being used, people should be encouraged to take these, participate in a take-back day and take this opportunity to clean up your medicine cabinet, just like you clean up your garage or clean up your basement or clean up your pantry. This is an opportunity to clean up your medicine cabinet and get rid of these medicines.
What about equipment or other things like that? Are those also part of this?
Yeah, that is also something that many programs, many take-back programs will accept. You frankly may know a little more about this than I do with respect to the specifics of a given program, but it's certainly the case that people have medical equipment as well, such as syringes, other sharps, for example, from settings where they've needed those in the past, but they're no longer needed. And that sort of stuff is also, not bad to get rid of and to do so and dispose of it in a responsible way. And these are programs that are collecting thousands and thousands of pounds of medicines or medical equipment and are equipped to dispose of them in ways that are environmentally sound and really minimize the potential harms that could otherwise occur.
Okay, so I'm going to use myself as a test case here, and we're going to walk through what I could actually do in a couple, for this day, which I need to.
Great.
So I'm going to go to my medicine cabinet, and I have been through IVF, and so I have a bunch of used sharps, I think they call them, or needles.
Yeah.
I also then had a successful pregnancy and had a C-section, and they gave me some pain medication when I left the hospital that I ended up not needing all of. So I'm going to gather all of these things up, and I'm going to, put them in a bag and just take them somewhere?
Yeah. Well, I mean, there are take back programs all around the country on these days, and it's remarkable the volume of materials that are collected. And so, in your case, it sounds like it could be a twofer. I mean, many. You don't have to look far to find somebody that's had a healthcare encounter and ended up with a prescription for more, for example, opioids than they needed. And so your example is not atypical, where someone may have had a C-section or another minor surgery, may have really needed 2 or 3 days supply, but ended up with 2 or 3 weeks instead. Now, we're in a very different place than we were a decade ago, and there's certainly been a massive reductions in opioid dispensing, for example, over the past 10 years. But we are still seeing many people that end up with more than they need. So yes, in your case, I'd say, take a look, use the internet, or take a look, and certainly if you've seen announcements about take back programs in your neighborhood or in your community, pack up those medicines, pack up those sharps, and drop them off. They're much safer being disposed of than sitting around your house for the next 10 years.
And I'm guessing that, if people aren't aware of these things and say they just go to clean out their cabinets, they might maybe flush these things down the toilet or throw them in the trash. And that's probably not a good idea, right?
Yeah, it's not. I mean, I'd say it's second or third best. For a while, I haven't been on the FDA site this week, but for a while, the FDA was noting that, that flushing things is not, they were discouraging that, but noting that may be what people do. But there are much better ways to dispose of these materials. Of course, you can't flush device equipment, sharps and the like. But for the pills themselves, it's far better from an environmental perspective to take them to one of these programs, to use one of these take back days rather than to flush them down the toilet. We have had in the past, few years, more and more visibility of and development of sort of disposal pouches and other technologies that allow for you to sort of deactivate the medicines, make them chemically inert, and then to dispose of them safely. And many pharmacies sell or provide these sorts of pouches in some settings. But I think it's a bit easier and cleaner just to go gather the medicines and then drop them off at one of these take-back programs.
Right. So how can people find one of these spots near them?
Well, they are, again, I mean, they are being instituted in more and more communities around the country. It's one of these things where you may not be aware that there's a program, but if you look online, you may be surprised what you find. So there are literally thousands of communities around the country that are participating in these events, often sponsored by hospitals or health systems themselves. Sometimes community organizations, are playing a very important role. And so I think that's where I would direct people to look.
Yeah, I've seen even law enforcement groups putting out a table and having safe disposal events on this day.
Yeah, that's exactly right. And of course, there are many permanent programs as well. And I think that's important to emphasize. So it's not as if you miss this day, if you happen to be listening to this, in early November instead of late October, there's nothing for you to do. There are many, many hospitals and health systems and community organizations and law enforcement organizations that are increasingly developing and maintaining take-back programs. It's stunning if you think that some incredible percent of the United States, I don't know if it's 75 or 80% or something, lives within 5 miles of a pharmacy. You think about how accessible pharmacies are. I've argued for a long time, it should be no harder to get rid of a medicine that you don't need than it is to pick it up in the first place. And so we're fortunate that I think as one of many means to tackle the overdose epidemic, we've seen more and more institutions instituting these permanent take-back programs.
Would you say that this day is probably more about safety than anything else?
It's about a lot of things. I mean, it's about just good medication management. Yes, it's about safety. A significant proportion of non-medical use of controlled substances happens because the medicines are given or sold from one individual to another. And again, there's just millions of bottles of medicines all around the country that would be far better off disposed of than remaining in people's kitchen cabinets and bedroom nightstands. So yeah, it's about safety. It's about just good medication management. It's about making a societal contribution to reducing the vast reservoir of these sorts of medicines that are sitting in communities all over America. And so, the Drug Enforcement Agency's database does provide an ability to search by zip code for a program in your community. So I think, while I earlier said just check out the internet, I think the DEA's site is a very good place to start in finding a program near you.
I want to throw a number at you and see if this surprises you. I saw that in October 2021, for the state of Maryland, they collected 10,349 pounds of unwanted medications. That's just the state of Maryland during National Drug Take Back Day that day. What do you think of that?
I mean, it's 5 tons. That's a lot of medicines. If you think about how many pills that is, that's a lot of medicines. And so I think it's that sort of social math that really reminds us of what an opportunity there is here and of how important this sort of undertaking is.
Well, Caleb, thank you so much for being on the podcast and for talking to us about National Drug Take Back Day. And we will hopefully see another 5 tons of unwanted medications collected, at least in this state.
Yeah, well, thank you for shining a brighter light on this. And, it's an important area, and I'm pleased that you're spending a little time talking about it with your listeners.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.